Maryland students have weathered a lot of changes this academic year thanks to health and safety protocols like masking and testing. They are back in the classroom now, and vaccines are paving the path forward towards a pre-pandemic normalcy. Well, Baltimore City was one of Maryland's first school systems to implement a COVID-19 testing program, and now the school system working with the city's health department in the latest vaccine effort. And joining us now, City School CEO Dr. Sonia Sanalisis with a look at what's in store for students and parents. Thanks for joining us this morning.
Always good to be here, Jason.
Hey, this is an exciting time. That 5 to 11 group now getting their chance to get the shot. For someone who leads a school district, what does it feel like for you?
Oh my gosh, it is such a wave of relief to have this age group now have the vaccination option for families. I will say it's major. It really is.
I assume for your district, just like everyone else, you've had a plan in place getting to this point. Tell me, what will it look like? I'm curious, both as a reporter and as a father of 2 kids in Baltimore City Public Schools.
Sure. So one of the things that will remain consistent even with vaccination for this age group is we will be partnering with Baltimore City Health Department, Dr. Daraza and her team. And so we will be using some of our schools as vaccination centers. So we have had school leaders who've been surveying some of their parents, looking at where the zip codes are that we need to provide more vaccination. We'll also partner with the health division to do some of what we've been doing already, even with things like testing, and that is going to those sections of the city and actually doing outreach where we see lower vaccination rates. So for us, this is a continuation of a great partnership with Baltimore City Health Department.
We were part of a panel together recently, and I heard you mention that, listen, you're ready to send kids out on field trips again and get out in the community again. Does this afford you that opportunity more now as these get rolled out?
It really does, Jason, because what it does is it gives parents an additional sense of security. So there have been parents, families that we know have been waiting for this age group's vaccination time to occur. And so what that means for things like field trips, back to the Hippodrome and the aquarium, is that it means, we'll be able to have just another layer of mitigation to keep kids safe. We'll also be able to kind of expand the reach and the comfort of families and their kind of easing of fear. So it's a great day for us.
Let's talk a little bit about the fears, though, as you talk about parents. There's some that you're still going to have to do a little PR work to get them either to get vaccinated or understand what the testing protocol would be. Tell me about that conversation and what has to happen for some of them who might be hesitant still.
Well, and it's understandable. And I will say that as a mother myself with city school students, one of the things that as a parent I understand is that information is key. Getting direct answers to your questions are also key. And, one of the things that we've seen that's really effective, even with some of our older students, is places where students themselves are ambassadors or families who themselves are making the decision. Speaking with other families, and that information has been our best friend when it comes to bringing families on board. But families want their specific concerns heard. There may be things, for example, that are myths that we know are myths, but families still deserve to have their questions answered. So we're going to move forward with that. And, again, being with parents along the way, answering families and students' questions, because students themselves have questions.
Yeah, I'm sure. We heard plenty over the last 48 hours as we did that panel. But just tell me about the joy for kids. I mean, we went through this whole school year of working at the kitchen table. I did way more math than I planned on doing last year. When you walk through schools now and you get to see the traditional way of doing work, what is that feeling like in city school?
Oh my gosh. I mean, Jason, it is the best. I tell people being in classrooms, particularly exciting classrooms with very skilled teachers, is the best therapy, post-pandemic therapy I could ask for. So what I see is joy. I walked into a pre-K room last week at Dorothy I. Height, and a little boy, as I walked into the room, I don't even think he knew who I was, Jason, said, "Oh, we're getting ready to carve pumpkins. You're just in time," right? And older students who, even though, they've got to remain cool when they say it, are like, yeah, it's kind of good to be back with my friends.
Sure.
And that, even, top students are saying it's so much easier for example, to do well in math when I had the teacher right there to ask questions. So I've been out in schools at least 1 or 2 days a week since September, and it's just invigorating to see young people kind of coming back. And that means that we also have to have more supports for them, because some young people are coming back and need additional supports based on, some of what they went through over the last 2 years. So it's mixed, but
Sure.
I always feel better having young people back in person, being able to learn and enjoy school again.
Sure. And one last thing, parents should just look out for emails and phone calls and things from school as we get closer to these clinics and that kind of thing to get these shots in arms. Yeah.
Yes, absolutely. So always go to our website, always check in with your school principal. Again, we're working with Baltimore City Health, kind of taking their lead in this, and we'll be announcing the schools that will be serving as vaccination sites beginning next week.
All right. Dr. Sonia Santelises, thank you for your time this morning. We appreciate it.
Thank you, Jason.
Sir. And to give us an update on what's happening in Harford County Schools, the Superintendent, Dr. Sean Bolson. Thanks for joining us, sir. It's always good to see you.
Thank you. Great to be here. Good to see you.
Hey, first, just give us an update of how things are going as you deal with school and COVID together. I was looking at your rolling metrics right now. Of the 5,000 or so tests that you've had, about 570 so kids right now out at least or isolated.
Yeah, I mean, that number, unfortunately, the number of isolations has stayed pretty consistent. We're still seeing transmission among our students. But we're working through it. People are kind of getting a little better at kind of rolling with the punches as it is, because school is going on and school is by and large going smoothly. It's just frustrating that some kids have had to deal with these types of disruptions.
Tell me a little bit about getting back to normal, because I have 2 kids. I know that working at home had its moment, but after a while you knew that being back in the class, you can see a spark going back into school. Do you notice that as well with your kids now back into a routine?
Oh, there's no question. I mean, the energy is there. I think students do have a different appreciation for being in school. But for some of our kids, our second graders haven't had a normal year yet.
Sure.
And, so we have some kids who really don't know what normal looks like. And that's been a little bit of a challenge as they've kind of had to relearn those school norms and habits and behaviors and those sorts of things. So that started to show up. There was a little bit of honeymoon early on where people really enthusiastic to be back, but now some of it's settling in and we're dealing with some of those things that, were the intangibles, like how to stay in class the whole time.
Yeah, right. Give me your thoughts now with the Pfizer vaccine being available to 5 to 11-year-olds now, and how that can affect schools if parents decide to go ahead and do it.
Well, I really hope it, just as the previous vaccine, when it rolled out for adults and then older students, it helped knock that transmission down a bit, and anything that reduces the overall disruptions in our schools. So I'm hopeful that we see a high percentage of people, have high percentage of families having that vaccine for the younger students, because it will have an impact. It will reduce disruptions at all of our schools.
And you took a step early on, and I want to make sure I get it correct. When it came to sports and fine arts, on the 15th, now you'll make it mandatory that testing will have to happen if you want to take part in these events. Tell me the thought process as you got to that.
The biggest difference between going through the fall without the testing and moving into it in the winter is this idea of going inside. The concern that so much of transmission happens when students are asymptomatic that just a basic level of screening to ensure that we can catch those asymptomatic cases. And so it is just one more measure to help us reduce the overall number of students who are getting sick, because when they come in and they're in touch with others and we still need to quarantine, that can be really disruptive. And we've had big disruptions for our athletics as well. And I just think the fear of having the students being indoors with the spectators, and a lot of these sports students are, they're all close contacts. There's not a lot of social distancing in the winter sports. So that's just one more way to reduce the overall transmission.
Excellent. I'll tell you what, we hope you have a good school year. We hope to see that number, the isolations and quarantines, get down to 0 at some point for you folks there
fantastic.
in Harford. Thank you again, sir.